All right. Hello, everyone, and welcome to our last session of Closing the Adolescent Care Gap, putting adolescent sexual and reproductive health QI strategies into practice. For those of you who have joined us over the last 2 weeks, thank you so much for participating in all 3 sessions. And for those of you that are new, we really thank you for joining today, and we encourage you to look back at the previous recordings if any of our previous topic sessions are of interest to you. So to start, my name is Mikayla Bobrow, and I am the project lead on the Quality for Teens project from CAI. And I've had the pleasure of working with NACHC and CDC on this initiative over the last several years. So today's session is titled Partnering with Young People to Strengthen Youth-Centered Sexual and Reproductive Health Services in Community Health Centers. And we have a great panel of speakers today to discuss this topic from various perspectives and to discuss how the Quality for Teens, or Q4T as we'll call it, how this package can help you in this area. So before we jump into all of that, though, I do just want to cover a few quick housekeeping items. So first, please just note that continuing education credits are available through the CDC Train system. Instructions for completing the evaluation and obtaining CE will be emailed after the webinar, and the deadline for obtaining CE is June 22nd. Please just note our disclosure slide here. CDC, our planners and presenters wish to disclose that they have no financial relationships with ineligible companies. And lastly, just a few quick friendly reminders. Today's meeting is being recorded. All attendee video and audio functions are disabled by the host, so please submit any questions and comments in the Q&A box at any time. We would love to get your questions, and we hope to get to all of those questions at the end of today's session. And then lastly, please don't forget to take the survey at the end of today's event. We really love to get your feedback to hear what you thought about the session. So with housekeeping out of the way, I want to introduce our amazing panelists for today's conversation. We are joined by Laura Davis and Karen Torres from Advocates for Youth. Laura is the Director of Adolescent Sexual Health Services at Advocates for Youth. Laura has more than 30 years experience in program planning, project coordination, teaching, training, and organizational development in the field of reproductive and sexual health. Karen serves as the Program Associate in the Division of Adolescent Sexual Health Services at Advocates for Youth. Karen has over 6 years of experience working on sexual and reproductive health issues and peer education. She is one of the early founders of the Reproductive Health Access Project, a youth-led intervention designed by Advocates for Youth and El Rio Community Health Center in Tucson, Arizona, to improve the quality of SRH services for teens and young adults. We are also joined today by Glorimar Irizarry and Tatum Hathaway from Holyoke Health Center. Glorimar is the Women's Health Program Lead for the Holyoke Health Center, a federally qualified community health center located in Western Massachusetts. And during the course of her time there, she's had various roles within the health center, including depression care manager, adolescent care coordinator, and program coordinator. And in her current role as Women's Health Program Lead, she oversees sexual reproductive health programming integration through the clinic's primary care services. And Tatum is a senior at Northampton High School. This fall, she is studying abroad in London through UMass Amherst, where she plans to major in public health. And she has been a member of the Holyoke Youth Board since 2023. So I want to quickly share with you all how we will be spending our hour together. So we will start by discussing what the Quality for Teens package is, and how you can access it to help improve adolescent sexual and reproductive health services at your health center. Next, we will hear from Laura and Karen about partnering with young people to strengthen youth-centered sexual and reproductive health services in community health centers. And then we'll end our hour together with a conversation with Glorimar and Tatum about Holyoke Health Center's use of the Q4T package and how they engaged young people in that process. So to begin, Q4T is a quality improvement package containing a collection of strategies, tips, tools, and informational materials to promote optimal adolescent sexual and reproductive health care. It's a ready-to-use resource for health centers, and there is a digital version that's available online, as well as a more detailed PDF that anybody can download. The purpose of Q4T is to facilitate the scale-up of quality improvement of adolescent sexual and reproductive health, or ASRH, services in community health centers, with the primary focus really being on federally qualified health centers. So Q4T is organized in two main sections. There are ASRH clinical services and youth-friendly practices. And then within those sections, there are 8 improvement goals, which you can see listed on this slide here. And these improvement goals were selected based on lessons learned from previous ASRH initiatives, as well as current guidelines and recommendations, published evidence, and stated importance by adolescents in literature. So this slide here shows the homepage of the Q4T website. You can see right in the middle of the page, there is a short video you can watch that will tell you about what Q4T is and how the strategies included can help your health center improve ASRH services. And then right above that video, there is a drop-down bar that says ASRH improvement goals, strategies, and tips for health centers. So that will drop down and show you the 8 improvement goals that you saw on the previous slide. And then you can click on that and go from there. And then on the top bar where you see that red circle, you can see there's an organizational readiness section. There is a needs assessment section, an improvement goal section, and a section for supplemental tools and resources. So the organizational readiness section can help health centers better understand both how to use Q4T and understand if they're ready to use it. So this includes information on securing leadership, on identifying clinical champions, on identifying an improvement team, selecting a QI framework and techniques, identifying performance measures to track your progress, and planning for aligning new workflows within the EHR. The needs assessment that is included in this package was created and tailored for Q4T and can help health centers identify which goal or goals their improvement team wants to focus on. There's also a link in this section to an interactive action planning tool, which provides space to track progress towards the selected improvement goal. And then this slide here shows 2 screenshots from the welcoming and accessible environment established. So this is just one of the goal areas that's included in the package, and we'll be talking about this goal in more detail today. So in the first image on the left, you'll see at the top that we're looking right at the improvement goal of welcoming and accessible environment established. And then below that, you can see in purple, it says strategies, and then you can see the 5 change strategies that are included in the package that can help your health center achieve that goal. Each change strategy is categorized by focus area. So the first focus area is dark blue and says key foundations. So this means that the change strategy is related to assessment, policy, and environment. And then on the left-hand side, you can see the key for the focus areas that provides a description for each of the focus areas. And then in the image on the right, you can see the details for one of the change strategies, engage youth to both assess and help create youth-friendly spaces. So below the change strategy, you'll see implementation tips in blue, and these are just ideas for the health center on how best to implement their selected strategy. And then below that, you'll find tools and resources that correspond with each strategy, and you can go directly to those tools and resources. So it's laid out the same for each of the different improvement goals and each of the change strategies. So as part of the supplemental tools and resources section, Q4T also provides example performance measures related to the 8 ASRH improvement goals. And these are not an exhaustive list of measures and are really just intended to help improvement teams consider what performance measures could be used to monitor progress toward achieving their improvement goal. So I know I walked you through this package quickly, and hopefully you'll all have time to take a look at it in more detail later. But I want to ask you all a couple questions about your current practices at the health center or health clinic where you work. So we're going to launch a quick poll. If you can just respond to this statement, the physical space is inviting for adolescent patients at my health center or health clinic. And please answer, does this describe your health center well? Are you almost there, just getting started? Or maybe it doesn't really describe us and something we want to work on in the future. I'll give you all a few more seconds to put your answers into the poll. All right, I'm seeing a lot of responses coming in. I think we can go ahead and close this out. All right, so it looks like there's a really pretty even split across all of these. that the physical space is inviting for adolescent patients. So just to share, there are a lot of resources in this package to help get you started if this doesn't describe you at all. And even if this describes you well, there's still resources and tools for those of you who are doing a great job but want to keep improving and making that space even more inviting to your adolescent patients. We're gonna launch the second poll here. So this statement says the environment for LGBTQIA+ adolescent patients is welcoming and accessible at my health center or health clinic. So some examples might include all gender restrooms, gender inclusive language, opportunities for patients to share gender pronouns. So again, please respond if this describes your health center well, almost there, just getting started, or doesn't describe us. And again, we'll give you just a few more seconds to go ahead and respond. Okay, it looks like most people have responded, so we will go ahead and close this out. All right, so again, a bit kind of all over the place. We see 18% of you say this describes your health center really well, 20% say almost there, 33% say just getting started, and 30% say this doesn't describe us. So there are so many tools and resources in Q4T that are available to help make your health center or health clinic a more welcoming environment for the youth that you serve, including making the physical space more inviting and also making sure that it's really welcoming to LGBTQIA+ adolescents. So with that, I want to now turn it over to Laura Davis from Advocates for Youth to talk to us about the importance of partnering with young people to strengthen youth-centered sexual and reproductive health services in community health centers.
Hello, everyone, and welcome. It's great to have all of you here today. Thanks to Karen and Mikayla for inviting us at Advocates for Youth to share this time with you. Our presentation focuses on engaging young people in improving the quality of SRH, sexual and reproductive health care. And so we're going to first just talk a little bit about some of the common barriers that teens experience when seeking care, talk a little bit about the principles and strategies that Q4T recommends for creating youth-friendly environments. And then I'll pass it over to my colleague, Karen, who will share more about our youth-adult partnership approach. It's an intervention that we call the Reproductive Health Access Project. Before we dive in, I just want to say a few words about Q4T. As Mikayla said, I've worked in this field of adolescent sexual and reproductive health for more than 30 years, specifically on youth-friendly services. And I've had the privilege of working in a variety of capacities, from innovative research initiatives to clinical guideline efforts to advocacy and health communications. And every so often, there is a publication that's released in our field that radically shifts the paradigm. As I have said to the folks that created this, I really believe that this is one of those publications. Its focus isn't simply on changing the knowledge, attitudes, or behaviors of individual teens, of individuals. It's really focused on changing the behaviors of adults, of our systems of care. And it doesn't just tell us what to do, but how to do it. So often we know that something needs to be changed, but we just don't know how to go about making that change. And this is really your guide. I love how it's so focused on sort of a choose your own adventure pathway to change. It recognizes that change takes time, that we all work in different contexts, that we need to build on what's already working. We need to create sustainable changes that we have the resources to do. And this is just a wonderful way to kind of figure out what would work best for you all. So I just want to start by thanking all of you who worked on this package, to NACHC, to CAI, to CDC, and of course, to the many community health centers that were involved in envisioning, researching, piloting these strategies. So that's all to say thank you. So let me tell you just a little bit about us. Advocates for Youth is an international nonprofit advocacy organization headquartered in Washington, D.C., that focuses on teen and young adult sexual reproductive health, rights, and justice. And our values are summarized in our motto, rights, respect, responsibility, that young people have the right to comprehensive medically accurate information and services. All young people deserve respect, and that adults have the responsibility to ensure that teens have unrestricted access to confidential, affordable, respectful care. El Rio Health Center is a 13-site FQHC in Tucson, Arizona, serving more than 120,000 patients a year. Karen's going to share a little bit more about El Rio in a minute. Next slide, please. I know that you all are very familiar with the barriers that young people face, whether it's lack of knowledge, where do I go, how do I access care, issues around legal restrictions. There are many, especially related to confidentiality, minor consent, parental notification, just the physical and logistical barriers, the hours, transportation services, lack of provider knowledge and skills, limited services, limited supplies, and then, of course, the cultural stigma around teens seeking sexual and reproductive health services. So next slide. I love the last 3 quality improvement goals in Q for T that start with creating a welcoming and accessible environment. And I'm not going to go through each of these on the next 3 slides. We just sort of highlighted what those primary goals are. But I want to encourage you on page 38 to 47 of the toolkit, if you download the PDF, it focuses on all sorts of ways to, all sorts of strategies for creating a welcoming and accessible environment. Next slide on ensuring confidentiality, various ways to do that on pages 48 to 53. And then implementing trauma-informed approaches. So what we're going to talk about today is our approach to engaging young people to implement all kinds of these strategies. And so next slide. We call this the Rights, Respect, Responsibility, Reproductive Health Access Project, or 3Rs RAP. It was developed through a collaboration between advocates and El Rio Health Center starting in 2017. It's what we consider a very innovative clinic-based strategy for addressing high rates of sexual health disparities. And again, grounded in a youth-adult partnership approach where we hire teams of young people to work alongside adult staff to improve programming. And it does in so many ways reflect the principles of Q for T in that it's evidence-based, youth-centered, culturally responsive, trauma-informed, but also focuses on the kinds of strategies that Q for T proposes in terms of looking at the how, what's the implementation process? How do we make sure that that process of engaging everyone in the health center, making sure that our strategies are feasible, acceptable to both our clients as well as our staff, and that they are adaptable, that we can be, that they can be tailored, and then certainly sustainable. That was one of our biggest goals, was to create an intervention that would really shift the systems of care. Next slide. So I will just mention this, that that as we developed it, we looked especially to a number of theoretical models. The collective impact approach is the one that we're going to focus mostly on today in sharing the step-by-step implementation process, which mirrors the implementation process that collective impact, where they looked at the question of what are the sort of preconditions that the most sustainable, effective public health or social change initiatives have made. Like, we can put a whole bunch of funding or time or energy into trying to make changes, but what are the most important essential elements that at the end of the day will make sure that an initiative is sustained? So next slide. I want to just acknowledge that our project comes out of a long history of working closely with CDC's Division of Reproductive Health and the demonstration projects that they have sponsored over the years. I was involved in both of these initiatives, or actually the 2010 to 2015 was one that Advocates was a technical assistance provider for. And then we took a lot of the lessons learned from the Teen Access and Quality Initiative that CDC sponsored from 2015 to 20. So next slide. Karen's going to show this video for us that gives you just a snapshot of RAP, and then she'll go through some of those core strategies. We have a 6-step process, and then we're going to tell you sort of what that picture looked like, what the story is about RAP, and then I'll come back at the end and talk about our evaluation and our efforts to sustain the effort. So I'll pass it to you, Karen.
Hi, y'all. My name is Karen. My pronouns are she, her, ella. And I've been a part of RAP for 6 years now. So since I was 18 years old, I was a peer educator. And I'll talk a lot about how RAP started, how we became honestly just a really successful project. But I'll play this video first to give y'all, again, a little snapshot of what our project actually looks like on the ground.
So RAP is a program that is designed to give young people decision-making power about their own sexual and reproductive health.
I would describe RAP as being a youth-led movement in changing the system of how we talk about sexual and reproductive health care. RAP is unique because we use the peer-to-peer model. So it's us youth teaching other youth about comprehensive sex education, because a lot of the times young people want to know, like they want to learn about their bodies and about their relationships and other people, but they can't because their resources just aren't out there. But if they were, they would seek it out. Like just growing up, I went to 2 different schools and both of them did not teach comprehensive reproductive sex education. I joined RAP when I think I was 17 at the time. I'm a peer sex educator in clinics and then also in community spaces. I'm going to give you like a crash course resources available to you today. And then after this, you're going to be able to see a provider and get those resources the same day. We like to start off with birth control myth busting because there's just like so much information or misinformation.
So I'm a family nurse practitioner. I run the teen clinics here at El Rio. And the project we started was 6 years ago in 2017. The young people are the ones out in the community who are getting the other teens to come to our clinics on social media. In that first year, where we went from 0 people, we served 4,000 teens for the remainder of that year. It just became a part of what teen culture in Tucson was.
Seeing young people take their lead into their reproductive health has been like really impactful for me. I was 15 years old when I joined RAP. A classmate of mine in high school had joined RAP, and she told me I went to a meeting with her, and then I ended up staying. So that's how I joined RAP.
So that's a little intro on RAP. We're going to be going through each of these steps from our implementation process, from step 1 of creating the project infrastructure to the needs and assets and resources, to creating a shared vision, implementing mutually enforcing strategies, monitoring and evaluating, and then sustaining the efforts. Like Laura said, a big part of how we created this and what we wanted was to make it sustainable so that it wasn't just this like 1-year project. We really wanted it to be like long lasting and embedded into the health center. So this is what RAP looks like. There's usually about 15 to 20 of us. We started off much smaller. We started off as a group of like 6 or 7 young people, but it's grown since we've started and we've been able to have more young people. But everyone here is between the ages of 14 to 24. So for step 1, we created project infrastructure and leadership teams. And step 1 honestly includes a lot of different things. So the next few slides are just going to be on step 1. But what first happened was that El Rio partnered with social service agencies and hired a program coordinator who's a family nurse practitioner who has over 20 years of experience in sexual and reproductive health and in youth organizing. So they recruited a lot of young people from these social service agencies, and us, the youth leaders, helped build the program through the lens of our lived experience. So, and one of the first things we started doing was like really seeing the lay of the land of the health center, in the policies and the procedures as to like what were the barriers in place that was keeping young people from participating in the health center, coming into the health center, or even working in the health center. And we started changing a lot of those policies and procedures. For example, there was one policy that said to work at the health center, you needed a high school diploma, which wasn't going to work for us because a lot of us were still in high school. So we changed that. And we also get paid a competitive salary. We're provided badges with access to all clinic spaces. And we receive transportation and meals for all of the RAP events that we participate in. And the health center has really made sure that we have this institutionalized and embedded role in not just receiving sexual and reproductive health care, but also delivering sexual and reproductive health care to our peers. So we work as quality improvement researchers, educators, case managers, outreach workers, and advocates. And we really work in this youth adult partnership model where, again, young people and adults are working as partners and collaborating together, understanding that this project without the young people would not work, without the adults would not work. So another part of step 1 is getting everybody trained. So the young people and the providers and the staff. In terms of the young people, we host a peer leadership academy twice a year. It's completely like led by and organized by young people. And there's trainings that include topics on youth leadership, sex ed, storytelling, trauma-informed care, reproductive justice, racial justice, and more. And we really receive ongoing mentorship and training on different skills in peer leadership and advocacy. And this is what our peer leadership academy, what it looked like this last time we had it, and this was one on storytelling. So training the staff and providers is also really, really important. So we conducted and continually host extensive trainings for health center staff and providers with a few core topics, which a lot of them, these topics are really identified by young people and the program coordinator that we work with. It's on adolescent development, sexual and reproductive health care for adolescents and young adults, confidentiality and minor consent, youth adult partnerships, and trauma-informed pelvic care. So for the second step, included conducting needs and resource assessments. So we really wanted to assess the sexual and reproductive health needs of youth in Tucson's community, and determine the quality, accessibility, and reach of sexual and reproductive health care, and identify these evidence-based, feasible, and again, sustainable strategies for change, because we really wanted to make sure that we were addressing all of these barriers, but making sure they were in a way that the health center could sustain it. So, regardless of, the amount of funding that we had, or how many young people we had available, or how many providers we had available, that we were creating these strategies that could be sustained throughout a long period of time, and just ended up being the culture of the health center. And then for step 3, we developed a common vision. This was guided by the needs assessment findings, the youth leaders, and the adult allies that focused on these 3 key areas of improving the quality, increasing access, and expanding reach of sexual and reproductive health for teens and young adults in Tucson. And part of developing that common vision was creating this mission statement. that says that our goal is to empower young people with the information, services, and support they need to make informed decisions about their sexual and reproductive health that's right for them in their lives. A big part of our shared mission is making sure that young people know that they can trust their decisions as long as they're given all the information available to them, and that they, deserve or have the right to participate in the systems and policies and services that affect them in their lives. So step 4 is developing these mutually reinforcing strategies. So we worked a lot with clinic leadership to design and implement numerous strategies. And part of that was hosting these teen clinics, which is our really signature program. And it says teen, but it's for people ages 14 to 24. And what happens at these clinics is that young people from the community are able to come in, they see the peer educators first, and we basically give them this like crash course of sex ed and the services available to them that day. And then they can get services that same day, including free or low cost, like birth control, STI testing and treatment, pregnancy testing, and more. And the time they spend with us before seeing the provider is a really important space to learn about everything available to them, time to answer or ask questions, tell us about what they're nervous about or their stories. And it's a really important space for young people to feel empowered that they can go to the provider now knowing everything available to them and that they can really advocate for what they want. We also do a lot of community outreach and education that I'll talk about in a second. And we also manage a large growing social media platform. That's how the majority of young people even know about us and our services, or that we're even there, is through our Instagram. So a lot of it is young people sharing our stories and sharing our posts. Yeah, so the majority of young people that come into our clinics are like, yeah, we saw you guys on Instagram. And here are some examples of quality improvements in the delivery of care at El Rio. So again, focusing on increasing access, ensuring high quality of services, and expanding the reach. So to increase access, we offer appointments outside of school hours. So during evenings and on weekends, we offer free transportation to and from clinics. We have same-day appointments and telehealth services. And also to ensure high quality, we make sure that we protect the confidentiality in medical records and billing, and we explicitly tell this to young people. We make sure that they know that coming to us means that they're going to have a confidential appointment. We offer time alone to all teen clients, and we also provide the full range of contraceptive methods, again, for free at or low cost. And we can also refer to specialized services that we don't necessarily offer right then and there. And examples of this include substance abuse support and also mental health support. And to expand the reach of services, we really try to focus on reaching marginalized youth in the community. We develop formal partnerships with social service agencies. And we do a lot of digital outreach and education to make sure we're reaching a ton of people in the community. And here to the right is just an example of one of our stories really marketing the sexual health clinics. Another example of quality improvement is through this AZ Shine line. So this is a teen-only appointment line that we created because young people would call the regular El Rio line, and a lot of the times they maybe didn't know about our program, or they were on hold for like 20 minutes, which if you're a young person who's in high school, 20 to 30 minutes is all you have for your lunch period. So we really wanted to make sure that we were allowing young people a more streamlined way to access appointments. So this line will have like their answers to their questions within 3 to 5 minutes. They can schedule appointments, again, ask questions, schedule transportation. So this line is really meant for young people and to make it as easy as possible for them to schedule appointments. Another quality improvement strategy is through our telehealth services. So this is when teens can see a provider through their phone or their laptop. It really reduces in-clinic times and addresses these transportation barriers, because even though we offer free transportation to and from, sometimes young people just don't have that commute time available. So telehealth can be a really helpful way for young people to see a provider without maybe having to travel really far. We also implemented kiosks inside of community organizations like Youth on Their Own and Goodwill Metro and a couple of schools, where if young people don't have a phone or a laptop or a safe place to take their appointment, they can go to these organizations and know that they're going to be able to take their appointments there for free, and also in a place that's confidential and private. We also do a ton of tabling and outreach. We table at a ton of different events in the community that are for young people, for educators, providers, parents, and youth serving staff. And at these events, we hand out promotional materials, period packs, care packs, information, and answer a lot of questions. And this is actually where we talk to a lot of parents. So we don't have as much interaction with parents since we do a lot of community education specifically with youth. But at these tabling events, they serve as a really great place for parents to come and ask questions. And a lot of times parents are just really curious about what we're doing. A lot of times they have no idea that this is available. And yeah, they're able to ask questions. And a lot of times it comes with a lot of curiosity and great conversation. Yeah, so tabling and outreach is definitely a massive way that we get the word out about our org. We also host community sex ed sessions. We call them pizza protection parties because we offer pizza and it's a fun little party. So they're led by young people for young people. We do them with community partners or different organizations, that just need sex ed. And we have 1-hour sessions on birth control and STIs, healthy relationships, navigating technology, and gender identity and sexual orientation. And this is an example of one that we did at Campus Health at the University of Arizona. We also have done at El Rio an integration of the Amaze videos. And this is a picture of page 21 on Q4T's tool. And here is one of the tools and resources that they offer is these Amaze videos. So Amaze is a series of sex ed videos. They're like short 2 to 3 minute videos. They're meant to be like relatable and, easy to digest information. And I'll play this intro video. But first, just so y'all get a little lay of what Amaze is. This is Jane. She's a reoccurring character in the videos. And Jane is someone who's meant to be like relatable and funny. She messes up pretty frequently. She has a lot of silly questions, goes through a lot with her friends and her family and in relationships. And these videos are meant to answer a lot of common questions that young people have as they're growing up. So here's an intro to Amaze.
Can you get an STI but not have symptoms? Oh, I bet Amaze has a video for this. Yep, here it is. Wow, Amaze has everything. I wonder, who's behind all this great info?
Amaze.org. More info, less weird. It's no surprise young people have questions about STIs, relationships, and their bodies. When sex education means awkward lessons and embarrassing questions without honest, age-appropriate answers from trusted sources, young people are left in the dark, turning to misinformation online, pornography, and myths that other kids share. That's where Amaze comes in. An engaging, trusted resource making sexuality education universally available to the YouTube generation. Our flagship YouTube channel alone has over 50 million views. With multiple video series and distribution platforms, Amaze has evolved into a large international community of teens, educators, and parents. Amaze leverages the expertise of sexuality educators, the creativity of animation professionals, input from our youth advisors, and the power of the internet to create and share free educational resources.
That's true. I've learned so much, from relationships to gender identity and sexual orientation to what to expect at the doctor's office.
Amaze has over 200 videos, but our programming is more than just videos. Amaze provides lesson plans for schools, content and tools for parents and allies, integration into healthcare systems, and even a coloring book and comic. Parents love Amaze too, with many resources to help get through awkward conversations and become askable parents.
That explains why my parents stopped saying, "Jane, there are birds and there are bees." Now they give me real information that I actually care about.
Amaze is an open platform where we welcome and support global partners as they adapt, integrate, and disseminate Amaze resources to their audiences. Together, we can change the world and help young people build happy and healthy futures. Now, let's find out more.
I apologize. I went into the actual YouTube video. Let me reshare. Cool. So we implemented Amaze in a really cool way at El Rio. And parts of what we did was including these videos in our electronic health record system. So in Epic, providers have a way to really like prescribe these videos out to their patients, which has made it a lot easier for young people to, if there's not enough time in the visit to talk about a specific topic and a provider sees that a young person's curious about something, they could prescribe this video and be like, hey, I think this could help you out. We also have an Amaze playlist on our website, and it's a playlist of videos that we specifically chose for our health center. We also have Amaze videos playing in waiting rooms and also Amaze comics playing in the lobbies, like on the TV in the lobbies. And we also hand out a ton of Amaze materials. Here are examples of some. Providers and parents tend to really love these postcards because it's ones that, young people can just like fold and put in their pocket. They have QR codes on them, so young people can really find the information out later. And there's a ton of information for parents as well. So parents tend to really love Amaze too. And with RAP, we have some youth-directed passion projects that have really helped the young people in our community. One of them is self-administered STI testing. The protocol before was for a provider-swabbed STI test, and we really worked with senior leadership, with the lab, with providers to implement self-swab testing as an option to make it easier for young people. We also have an affirming wardrobe project that started from a young person in RAP that give out gender affirming clothing to young people in the community. And we also have a period mailing project where we give out up to 2 months worth of period products out to anyone in Arizona every single week. And I will pass it back to Laura.
Thanks, Karen. So I'm always so inspired when I hear Karen because as one of the original founders of RAP, we were able to bring Karen to Advocates for Youth, where she now works on our Amaze initiative, but also helping other community health centers do this work. And there are a number of young people who started with us in 2017 and then, are still with us. So I'll just say a word about our external evaluation. ICF Macro conducted that. We can do the next slide. And we found a 60% increase in the utilization of healthcare services and a 50% increase in contraceptive method receipt. So that has been a very significant change for El Rio and for the city of Tucson. Next slide. And I just want to say a word in terms of sustaining the program. El Rio has continually worked again to focus on other policy and practice changes, to secure additional funding, to establish a residency program. And currently we're collaborating with the Arizona Department of Health Services to replicate the initiative. Next slide. This is a film that if you all are interested in learning more, we're not going to play it now, but you can find this online. And then just to put a plug in for our future vision, we are really interested in creating a new career pathway for young people to work professionally in community health centers as SRH community health workers. And if any of you all are interested in learning more about AMAZE or learning more about RAP or thinking about how you might be able to engage in this, or if you have a group of young people that you would like us to train through our Youth Leadership Academy, we would love to partner with you. So we're hoping that in the next year, we'll be seeking different partners, and again, would love to have you all be engaged with us. So at the end of the slide, we have Karen's contact information, Karen Torres at advocatesforyouth.org, and feel free to reach out to us. Thanks, everyone, and we'll pass it back to Mikayla.
Thank you, Laura, and thank you, Karen. We really appreciate you both sharing about the work you both do and some of these important strategies to engage young people. So I now want to move our conversation to talk with Glorimar and Tatum from Holyoke Health Center. Holyoke Health Center participated in a 5-month Q4T pilot in 2022 and focused on the improvement goal of welcoming an accessible environment. So Glorimar and Tatum, thank you both so much for joining us today. I would love to start first from hearing from Glorimar, and then I'll turn to you, Tatum. But Glorimar, if you could just quickly share about Holyoke Health Center and the community that you serve.
Yeah, so Holyoke Health Center is located in downtown Holyoke in the Western Mass area. We predominantly see patients of Puerto Rican descent. Holyoke has one of the highest Puerto Rican population per capita, so about like 50% of our population is Puerto Rican. We in like our patient population, 70% are in the lower like federal poverty line, and at least 60% of our patients speak another language besides English. So, and we see about like 20,000 patients a year.
Great, thanks for sharing, providing that overview. Can you tell us about your health center's experience providing ASRH services?
So our experience providing sexual reproductive health care, specifically for adolescents, is Holyoke in general had one of the highest teen pregnancy rates back in like the early 2000s. And then it was initiatives such as an initiative called Youth First that came to our area in 2010 that was actually funded through the CDC. That we were able to kind of like work together as a community to lower that rate. So between 2008 and 2016, we were able to lower our pregnancy rates by 54%, but that was a community-wide effort. So in the mix of that, we actually were given funding through the state to help integrate sexual health care within primary care. That funding allowed us to get our staff trained in how to do proper contraceptive counseling, allowed our providers to get trained in LARC insertions and removal, and allowed us to actually have different kind of like more education and more kind of like removing gaps in care for our adolescent patients when it came to sexual health services.
Great. So your health center was selected to pilot the Quality for Teens package. Can you tell us a little bit about that experience?
Yeah, at the time when we were chosen to pilot, we were in a very good standing place specifically for like providing sexual health care. But we knew that there were still areas that we still kind of needed to improve on. And so when the packet was presented to us and with the team that I had, which was a pediatrician named Dr. Lakakis and a midwife named Joanna Rizzaniti, we actually worked together to see kind of like where were the gaps in our care. And one of them was being that we knew that we could offer a more kind of like welcoming and friendly environment for adolescent patients and their family when they entered our health center. So the Q4T actually allowed us with the assessment tool and stuff like that to kind of help kind of figure out what that we needed to focus on that in the 5-month kind of pilot period. So we were kind of like very helpful with all the resources, or very grateful, sorry, with all the resources that was provided in the packet, because it helped us kind of like figure out what we were going to do and what we were going to focus on. And the project, which was, we hosted a focus group of youth. So it was actually a youth-led kind of like health center assessment. So it was a 2-night event where youth came in and they got a tour of the health center. They learned about our services. They kind of saw everything that we had, like the rooms, the patient rooms, the waiting rooms. And then on the second night, they gave us feedback on what kind of like they liked and what were kind of changes that we need to kind of to instill in our health center to be more kind of youth friendly.
That's great. Thank you so much for sharing about this. I would love to turn to Tatum because I know, Tatum, you were part of these focus groups that Holyoke led. Can you tell us a little bit about your experience participating in the focus group and just what that was like?
Yeah, so I was asked to join the focus group in 2022, and it was just 5 or 6 participants that were meeting in Holyoke. And we mostly just talked about ways that we thought that like sexual and reproductive health could be more, we could become more knowledgeable about that as patients by the healthcare professionals. And it was a super fulfilling experience working with peers from the area to come up with ideas of how we can start conversations between our caregivers as not only adolescent, but also as patients with our doctors and staff at the health clinic.
That's great. Thanks for sharing. Is there anything else you wanted to share about what you gained from this experience participating in the focus group?
Yeah, I think that again, just the biggest thing was being able to connect with peers and start conversations, and also really learn about how like behavior and like sociability impacts how these spaces work, and how just like conversations between the staff members and then the patients, and how that was just really cool to see.
That's great. Can you share with us why was it important to have the health center incorporate the suggestions mentioned by the youth throughout the focus group sessions?
Yeah, it was super fulfilling and cool to see our ideas come to life in the focus group, and walking into the health clinic and being able to see what we came up with as just a small advocacy group in Holyoke was super cool. And also how all of the information that we came up with, it didn't go unnoticed, and how everybody was able to see that and the hard work that we did.
That's amazing. That's, yeah, really cool to be able to see that come to life. Wonderful. Well, Glorimar and Tatum, I would love to hear, are there any other accomplishments that you wanted to share regarding this work?
So I would definitely say Tatum is, because of the suggestion of her and the other youth who were part of the focus group, they were also very adamant that there should be a youth board. So this pilot took place in the spring of 2022, and we asked them to give us kind of like a timeline of when they wanted things. So by early January, February of 2023, we were starting our process of vetting for youth board members. And Tatum was actually one of the youth who was like, if you do create an advisory board or a youth board, I want to be a part of it. And so her, along with 6 other youth from the community, the surrounding communities, are our first kind of like initial youth board advisory group that we have here. We also, in seeing everything that the Q4T had to offer, internally, we updated our time alone policy because there is a tool in the Q4T packet that allowed us to kind of review what we had in our current policies and then how we can improve that. And we knew that we kind of needed to improve our time alone policy because not all providers were feeling comfortable asking parents to step outside. So in order to help our providers feel like they didn't feel comfortable, we would actually have a letter created to give out to all the guardians who come in here with adolescents.
That's amazing, both that you were able to create this youth advisory board and also this time alone letter. I have a question about the time alone letter. How did you get buy-in from leadership, and how were you able to really institutionalize the letter?
So getting buy-in from leadership, I will say that we have a good leadership team that kind of supports our sexual reproductive health care and services. And I think the biggest thing is making sure that you go to the right kind of like leader or chief, and keep them involved in the conversation and not make any changes without consulting with them first. So we have, you know, certain kind of like workflows here where our policies need to be updated every 2 to 3 years. So it was just happened to be that we were in the right time frame to have our minors' rights and confidentiality care, that policy particularly be in need of an update. So they were really like happy that we actually took the initiative to make some of these changes. So there wasn't really any pushback because, you know, at the end of the day, it's about the quality of care for our patients.
That's great. And then I just have one final question for you both. What tips would you share with other health clinics or health centers that are wanting to use Q4T or wanting to engage youth in improving their health centers' services and physical spaces?
I'll let you go first, Tatum.
Okay, yeah. I think that what was interesting about the youth board that's in act right now is that not everybody is from the same area. We're all kind of from, I mean, we live in Western Mass, but we are all from neighboring communities and towns. And so I think it's really cool to see how we can take what we learn in the focus groups and in our conversations together and take them to our separate communities. I think that was super fascinating.
I would also say as well, to kind of support like any clinic who wants to like do something like this or to incorporate the Q4T is really making sure that you have key people in the conversation and like really assess your agency and see kind of where are areas you can have improvements in. And really be realistic about like timelines, be realistic about if you need funding to make certain changes, see if there's something that you can start small and then kind of work your way into biggest. But it's really, I think the biggest thing for me is having that buy-in and having that support from senior leadership, because if you don't have that from the get-go, then it's kind of hard to implement any changes.
Yeah. I see one question in the chat that I would love for you to just quickly answer. Someone wrote in, what are some examples of things that young people noted to make the clinic more welcoming and affirming to youth? And were any of those things surprising?
Tatum, do you want to answer like some of the things? I mean, I know them from the top of my head.
Yeah, why don't you go? I can't think of any right now.
So, kind of like the 3 main areas was to have a teen space within our pediatric waiting room. So there's actually funding that was provided by NACHC. We were able to buy like sofas and have like comfortable furnishing. Also signage so that the teens knew where they could sit and kind of be in their own kind of area. The other thing was having literature. So like books that kind of really more correspond to like their interests, instead of having like, you know, the regular kind of like health magazines that are available and then they kind of like clinical waiting room. And then the last thing was having actually like a shelf or like space where they can go and get free condoms and sanitary products, so like panty liners and Kotex, without having to ask staff. So we actually put in a shelf in our pediatric waiting room that has all these items. And though we already had been given out free condoms, but it was one of those things where the youth had to kind of like talk to a clinical staff and be like, hey, I'm interested. Whereas now they can just walk into that particular bathroom and take what they need and not have to kind of go through the embarrassment of having to ask a staff for it.
That's great. Thank you so much for sharing that. Well, wonderful. We are almost at our hour. So thank you, Glorimar and Tatum, so much for sharing with us about your experience using Q4T, to create a more welcoming and accessible environment at Holyoke Health Center. It's really exciting to hear how you were able to implement those changes and then be able to create more changes off of that as well. So I know we aren't able to get to all of the questions in the chat. I do really encourage you all to please go check out the Q4T package. Go explore the website, download the full package, and especially look at this welcoming and accessible environment section where there's information and tools on time alone, on creating a more welcoming space. So for those of you that are interested. And then also, please take the needs assessment with your team and maybe think about an improvement goal that you think would be most beneficial to your health center to work on. And then also, I just wanted to quickly share, since we aren't able to get to all of the questions, we will try and email folks if you put a question in, try and respond to you there as well. So with that, thank you all so much for attending our third and final session of the Closing the Adolescent Care Gap Learning Series. It's been such a pleasure to work and talk to so many amazing people about the work that they've done. So yeah, thank you all so much. And please just complete the survey when you close out of Zoom today as well. We really would appreciate your feedback. So thank you all and hope you have a great rest of your day.